Okay, so what is AskGraph? So it is a way to think of 8 different things that the boards are going to ask you about. Again, it's a way to think about the 8 different things or 8 different things that the boards are going to ask you about. A lot of you guys were probably taught ABCs, airway, breathing, circulation. Airway and breathing sound like the same thing to me, and circulation is very vague. So ABCs don't tell us as much, but AskGraph will really define things for you. AskGraph is going to be much more helpful and more specific in helping to narrow answers down when you're dealing with a priority question. So AskGraph is only used for priority questions. It's kind of like our little cheat code. And each letter stands for something that we're freaking out about. So we'll look for one of these things in the answers to priority questions. So first we have A. A stands for airway. These do not go in any specific order, but airway is always number 1. Airway is always number 1. Again, they don't go in any specific order, but airway is number 1 always. Some keywords that may be screaming out airway to us: drooling, stridor, accessory muscle use to breathe. What about nasal flaring? Irritability. What about tripod position? So all of these things, angioedema, pulmonary embolism. How about singed facial hair? So if we see any of these things, we're thinking airway. We're freaking out about airway. These are things that are indicating to us that our airway potentially or is compromised. So again, airway above all else, airway above all else. Then we have S for sepsis. So with sepsis, you need to know a couple of things. We can have somebody that's hypothermic. So that's a temperature of less than 96.8. Or hyperthermic, a temperature over 100.4, as well as a low blood pressure. So these, again, don't go in any specific order. So remember that these don't go in any specific order, but airway is always number 1. Airway is always number 1. Okay, so low temperature, high temperature, low blood pressure, and a high heart rate. So what do we do first in this situation? What do we do first? Does anyone know? What do we do first here? Fluids, exactly. Fluids, 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 IV fluids, exactly. Then we have K. K is for potassium. If we have a low or a high potassium, they both are something that we're freaking out about it because they can both cause someone to go into a life-threatening arrhythmia like VFib. So we're freaking out about low and high potassium. Then we have G for glucose. Glucose less than 70 or hypoglycemia. You may see someone presents with unresponsiveness, and maybe they'll say they have a glucose level of 68 maybe. It could also say a patient or a person was found next to a bottle of pills and they have type 2 diabetes, overdose situation, but they're hypoglycemic. So now we have to be very careful of what we do with these patients, right? What about a patient that has, or a person that has access to insulin and decides I'm going to try to lose weight by taking a lot of this insulin? So giving the level would be the easy way that they'd show it, but giving other ways like overdose or an overdose situation, like I just mentioned, is another way that the boards can present this. Then we have R. R is for lethargy and grunting. Lethargy and grunting. So how do we describe a patient, for instance, that's less than maybe 5 years old? So in pediatric patients, we have to be able to describe them because they can't tell us how they're feeling, right? They can't tell us how they're feeling. So a lot of times in pediatrics, you'll see a child who's lethargic or grunting, and it's something that we're freaking out about. Then we have A. A is for altered mental status, or AMS. This is going to be hallucinating, hallucinations, seizures, confusion, psychosis. How about delusions? So these are all things that are screaming altered mental status to us. Disorientation. Okay, so these are all things that are screaming altered mental status to us. Then we have P for peritonitis. So why are we freaking out about this? So what is the peritoneum? What is the peritoneum? So it is an enclosure of the GI and reproductive tract. It's an enclosure of the GI and reproductive tract. So if we're having any issues like diverticulitis, appendicitis, cholecystitis, what's going to get irritated with that inflammatory process? The peritoneum, right? So what kind of keywords do we use for peritonitis? What about fever? Rebound tenderness? What about a board-like abdomen? What else? Rigidity? So all of these keywords, these are all keywords that we're using to say something's wrong with the peritoneum, which means something is severely wrong with our GI tract or GU tract, right? If you were to press down on this patient's abdomen or their stomach, and as you retract, do you think this person's going to scream maybe? Yeah, they're going to guard themselves, right? So that's P for peritonitis. Then last, we have H for hemorrhage. We have H for hemorrhage or hemorrhaging. So signs and symptoms of this that we're looking for are going to be low blood pressure and increased heart rate. Low blood pressure and increased heart rate. What if a patient was hemorrhaging or septic? What's the treatment in both situations? What's the treatment in both situations? IV fluids, IV fluids. Awesome, awesome job, you guys. IV fluids. So boards will try to trick you on sepsis by asking about, for instance, antivirals. Are we going to give antivirals? No, right? And then with hemorrhaging, they're going to say packed red blood cells. Are we giving packed red blood cells? No, IV fluids, exactly. Awesome, awesome, awesome job, you guys. So now, what if someone is post-op or post-procedure? Now we have what we call, let me delete this, we have what we call ASH of Asgraf, ASH of Asgraf. So this is post-op or post-procedure because we don't want our patient to turn to ashes. We don't want our patient to turn to ashes. So we narrowed it down even more. So we have airway, altered mental status, sepsis, and we have hemorrhage. So that is ASH of Asgraf, and that's for post-op or post-procedure.
I'm going to talk about needs, and I'm going to go over Nippa. So the first thing that I'm going to talk about is needs. So this is something that a lot of us are familiar with, and this is really going to follow through everything. It's going to apply to cardio, GI, maternity, mental health, all across the boards is needs. So what we want to do is we always want to educate our patients on their needs. Educate for starters. So the N in needs is going to be nutrition. So we always want to educate our patients on nutrition. And so nutrition is for N. And so nutrition, for example, you may see a select all that apply, a further teaching, further intervention question about educating a patient that perhaps has heart failure and the type of foods and things like that that we want to educate them on. And for example, with that, boards could maybe ask you something like that. And we want them to, of course, have, foods that are not high in fat. We don't want them eating more foods that have sodium and things like that. So that's where we could see that as well. And there's various other examples as well. Okay, so then the E, so the first E in our needs is going to be exercise. And so when would we say the opposite? We don't. We want to educate again. Nutrition, exercise, things that regardless of what topic we're talking about, it's going to apply all across the board here. And then the next E is going to be, it's ETOH, and that is alcohol. So that's the abbreviation here. So this is alcohol. I'm going to write it also here. Alcohol. And so we either want to decrease this or we want to avoid this. So depending on how boards has this in the question, if they have an answer choice for us that is to decrease alcohol, then we would pick decrease alcohol. And if they would have somewhere in the answer choice to avoid alcohol, of course, we want to avoid alcohol. This is going to apply to many, many things. We're educating about nutrition, exercising, of course, eating healthy, getting exercise, avoiding and or decreasing alcohol. And then the last two is don't smoke. So the D is don't, and then the S is smoke. When would we say the opposite? We don't. So that's what we like to always, we always like to say, when would you say the opposite? When would you tell someone, oh, it's okay to smoke. Oh, it's okay to eat, McDonald's, all this fast food stuff. Oh, it's okay to not get any exercise. Oh, it's okay to, drink lots of alcohol and things like that. You wouldn't. Needs is something, that's I always wrote on the top of my whiteboard as along with Ash, I wrote ASCRAF. I wrote all these little things on my whiteboard just to kind of keep myself organized and to kind of help me as I was going through with the questions and everything. All right. Okay, so that's going to take care of needs. So I'm going to erase this for everyone and then we'll get into our next mnemonic here. Next one. So the next one is Nippa, and we've actually added an extra A in for Nippa. So I feel like we're always adding to our Nippa here, which is good. And so with Nippa, if you don't know what this is, and this is your first time joining us, you're probably like, okay, what is this? And so what this is this is a mnemonic that we use within the GI track and different things that we want to do when our GI track is, if there's an emergency and or if we need to rest our GI track. And this can hold true in the PEDS GI, different disease processes that we go over. And then, of course, with adult GI concepts, like acid reflux, diverticulitis, pancreatitis, appendicitis, all kinds of things that this will kind of hold true throughout. For N is going to be NPO. This is going to be for two things. It's going to be to rest our gut because our NPO, we're going to rest the gut rest. And second, to prepare the patient for surgery. Because like I said before, who knows what type of GI disease process is going on. And as NPO, and I'm sure a lot of us are familiar with that, is that NPO is going to prepare them for surgery. So if they need to have it, they're ready to go. So that would be N. And then I is going to be IV fluids. I is IV fluids. Okay, so that takes care of our N. So N is going to be NPO, gut rest for the patient, and possibly preparing them for surgery as well. And our first P is going to be pain meds as needed. So pain meds. And here's another abbreviation, PRN, that is as needed. So get used to seeing that one as well, because that's going to come up, all the in charts And you're going to see that in real life. All right, so our first P is pain meds as needed. Our second P is going to be PPIs as needed. And PPIs are our proton pump inhibitors. So some examples of proton pump inhibitors can be our drugs that end in prazole. And so what these drugs do is they reduce the stomach acidity that is happening in our stomach for whatever reason that is. So they are going to reduce stomach acidity. Okay, so reduce stomach acidity, PPIs as needed. They are proton pump inhibitors and they end in prazole. And so some examples could be propantazole, omeprazole, things like that. They're going to end in PRAZOLE. So they're going to be the prazoles. And so again, they're going to reduce that stomach acidity that's going on with our patient. First A for Nippa is going to be anti-emetics as needed. And those are going to be if our patient is going to need. So why would we want to give our patient that? What's an antiemetic? Does anyone know what that is? It's given for if a patient has what? Yeah, if they're having nausea, vomiting, and yeah, I saw someone write it in there. An example is ondansetron, and that's a drug that's going to be given very, very frequently in real life, and then of course on boards. Ondansetron, and that is also Zofran. So, but for boards, you need to recognize ondansetron. In real life, you can use both. So that's our first A. So the first A is antiemetics, PRN. So that's, if our patient is if they're nauseous, if they're vomiting, you want to give them ondansetron, and that's going to help alleviate that. And we actually just added the second A just recently here. And our newest addition to Nippa is our last A, and that one is antibiotics. As needed. Just like we talked about the PPI, so we talked about that these are proton pump inhibitors, and we talked about those end in prazole. So some examples, antibiotics can be given within the GI tract, within the different GI. Would be, for example, you might see this a patient that has diverticulitis. And so there's an inflammation going on there. And so some drugs that would be good for that could be clindamycin, or we could also have metronidazole, which is also known as Flagyl. But for boards, no metronidazole. Real life, you can know both is good. But for the sake of boards, make sure you're able to recognize the generic names. Okay. So Nippa again. So we're going to use this when there's something going on with our GI tract, and it's used to help when we have problems in our GI tract. And it can vary from whether it's a peds patient that maybe is experiencing intussusception, maybe someone has Hirschsprung's, or maybe it's an adult patient that maybe is experiencing diverticulitis, maybe they're having pancreatitis or something like that. So we use them for problems in the GI tract, which can vary depending on what they are. And then again, our N is NPO. So we have our patients on as NPO for two reasons: to rest the gut, to give it a break, and also to possibly prep them for surgery in the event that they need to be prepped for surgery. They're NPO and they're ready to go. Our I is IV fluids. Our first P is going to be pain meds as needed. Our second P can be proton pump inhibitors as needed. And we talked about that those are our medications that are going to end in prazole, and also antiemetics as needed. And we talked about that is for patients that are nausea, that are vomiting, and that's an example would be ondansetron. And then our last one, which is our newest one, which is the second A, is for antibiotics as needed. And so an example could be, maybe a patient, this is just an example. Again, it could be, pancreatitis, appendicitis, IBS, it could be anything. But we also want to remember that the little caveat is with pain meds and appendicitis, it can we don't want to give pain meds because that can mask. We don't want to give continual pain meds because that can mask a possible rupture, and then we would be all the way back with Asgraf, and we'd be looking for hemorrhage. So that is something that we definitely don't want to do. But in this case, with diverticulitis, we can give them antibiotics. Again, it's just going to vary. It's going to depend on the patient, the provider,